I'm really privileged to be here and to present what we've tried to collate and curate as the mental health section of the guidelines. I'll be sharing a presentation and try and introduce the concept first of why we have put it in the way that we have. I'm hoping you can see, can everyone see the presentation? Thank you. So I think the central premise that we've been talking about since morning and that the guidelines also suggest is that gender and sexual diversity is in itself not a medical disorder or a disease. It is the natural order of nature, of humankind. And if that be so, if that's the premise that we're working on, then the question really arises about who are these guidelines for? If we're talking about something which is not a disease and there are mental health professionals and professionals getting together to create guidelines, then who are these guidelines really for? And what are we trying to find a solution towards? What do we wish to manage? So I think in our minds, often, as a psychiatrist as well, the issue first of all to be clarified is what is the problem? So that we can then look at what the solution could be. So what is it that these guidelines could be for? And this is a question that I think each individual has to first answer. So redefining this problem. And the picture I'm showing here is because often we look at the reflection and we feel that's the reality that we are trying to treat. And I think that's the question that I'm asking everyone, and that's the question that we are asking everyone. Are we really trying to, by treating the individual and calling it a disorder, are we really trying to treat the reflection and not really looking at what is the reality? That's the question that the guideline takes. So the mental health section says, this is not a medical problem in itself. Nothing and no one who is an LGBTQI individual has a medical problem in itself. So are we then looking at the impact of current social structures and the current stories and the current social discourse on the psyche of an LGBTQ individual, these folks, their families, and what that brings out in someone? And if that be so, then the problem is really social. It's not the reflection we've got to treat. We have to actually look at it from the reality of why this is being created, and look at the problem in its entirety. So the first part of the mental health guidelines actually posits that the problem is social. Therefore, the guideline emphasizes that a purely biomedical treatment of any sort aimed at the individual is not a complete solution. And the solutions that need to be created need to be within social structures, by social structures, and for social structures. I think this is the entire premise, which is why the framework of the mental health section is not so much in entirety about the individual. It is far more about what everybody else and the context in which this becomes a problem. So the guidelines emphasize the role that a change in social discourse has to play in the mental health of any of the LGBTQIA population. And it also goes on to say not just the part that this is playing in actually creation of the problem, but also the part that each social structure can actually aspire to play as part of being the solution. It actually fosters the belief, and this is very personal to me as well, that it really fosters the belief that each individual in society, regardless of who they are, whether they consider themselves a spectator, as an ordinary citizen, as an employee, as an employer, as an ally, as a family member, as a friend of someone from the population, anyone. It fosters the belief that each individual in society is responsible for and therefore has the ability to help in creating a safe and affirmative space for LGBTQIA+ individuals. So that's the entirety of the framework. And this is the basis of how the mental health section has been written. It's been written in various sections. The first section introduces the concept itself, just like I'm explaining it to you. It actually outlines the journey of being born as a child in India, in our cultural context, and going through the process of developing in the childhood and onwards, and what role sexual orientation, sexuality, gender, and its various dimensions play in the development of the child. And then, as you understand this part, the hope is that the influences that are on this child, that actually determine how gender identity is construed, is internalized, and later has to be externalized or talked about, all of those are then in context. They are now making sense, because this is how a child has grown up. There are hardly any stories, superheroes, movies that a child will see which talk about a variation in genders, non-binary gender, which talk about sexual diversity as normative, as just natural. A child who's being brought up without these stimuli at all is not likely to think that this is part of natural diversity. They are likely to think that this is an exception. And that's where, in entirety, the problem actually starts. So the guidelines actually talk about that, and the mental health section actually provides certain specific solutions to start from there. Then the specific section 1 of the guidelines is a section which aims to include the possible roles of anyone who's a member of this society, or else who is part of a social structure, or the leader of an organization. So the framework here is much like the previous panel was discussing. There are people in positions of authority in society. One is, are they going to take ownership? Because they lead organizations. The other is the most ordinary citizen who does not feel that they have too much power. They are also responsible. So right from one to the other, in the entire spectrum, the guidelines hope to address that each person can have some part to play. So each of these sections then attempts to outline and therefore empower the social structure or the individual within them by providing specific ways to help, support, and nurture the LGBTQI population. So that's how section 1 is written. One section talks about the social structures. So it's written in a simple language of just, what can I do if I am a system? So there are various sections. And in this, if I am a school, what can I do? If I am a college or a higher educational institution, what can I do? So that somebody who's trying to read the guidelines to see how they can participate, or how they can actually bring about a change, or what they can aspire to, then they know at least this section is relevant to me. They may or may not need to go through the entire guidelines, but at least this section specifically to them, they can start reading up on and taking from and aspire towards. If they are the employer of an organization, or people who have started organizations, what is it that an organization can do for gender affirmative care? What is it that family can do? What is it as a friend you can do? What is it as an ally you can do? And specifically also mental health services. If there are, psychiatrists, therapists, clinical psychologists, or just mental health services that are taking care of children, adolescents, adults, geriatric population, across the age span, what can these services do? So it's laid out in the section 1 of the mental health guidelines about what each social structure or any of these can do to aspire to be part of gender affirmative care, gender and social sexual orientation affirmative care. The other section within section 1 is what can I do as an individual, in which if I'm a family member, so there are certain sort of guidelines for parents about what they can do, and this is collated from the knowledge and the collective wisdom of families and parents and caregivers themselves, and from someone who has come out to their parent and what their ask has been. What would I have liked my parent to respond as? So it's collated and curated from the collective wisdom of lived experience. Other such individual related what can I do sections are that of an employer. So if I'm an employer and someone working in my organization, or if I wish to be an affirmative organization towards the LGBTQI folks, what is it that I can do? If I'm a teacher in a school, what can I do? And if I'm a mental health professional, what can I do? So these are some of the sections in section 2 that talk about what can be done. Sorry, this is section 1. So part 2 of section 1. The second section of the mental health guidelines, which is section 2, actually talks specifically about mental health care. And here I may say that there are 2 aspects to this mental health care. One is the aspect of this is about care and not cure. And I think that needs to be extremely clear, that no one from the mental health section, and we've talked about conversion therapy and how it's unethical and illegal, and the guidelines actually talk about how this is about care and not about cure. And the second premise is the acknowledgement that it is often not just the individual, it's also the family that's usually in need of care. That the vulnerability exists in not just the individual, but also the family, sometimes the partner, sometimes the family of creation, which could be their parents and siblings, and sometimes in the family that they are trying to make with their partners. So these are the 2 main premises of the mental health care section, which outlines some of the more sort of specific parts of mental health care. And it outlines 3 or 4 different things. One is that every mental health professional needs to be aware that there are certain more common patterns seen in this target group, specific to their mental health. And I think since the morning, we've touched upon some of these things about how certain kinds of aggression against the community, certain kinds of invisibility against the community. So the prevalence of trauma and is far higher in the queer folks than in other folks. So these common patterns of what to look out for is something that we all need to be aware of. So talking about the common patterns and then talking about comorbidities. Mental health is affected if someone is going through chronic conflict and stress, and that stress is due to the fact that they're having to navigate not just their internal world and the conflicts inside them and the self-doubt, but also have to navigate each interface, be it social, be it educational, be it legal, be it emotional. All these interfaces have to be navigated by them, quite apart from doing their daily living. So if this leads to the chronic stress, then we know that the prevalence of comorbidities in mental health, like depression, like anxiety disorders, like eating disorders, and other such related disorders, these can actually increase. And therefore, treating this and not keeping them invisible is also one of the parts that's extremely important. But it is also important to actually separate them from the identity itself and treat them as a mental health difficulty, quite apart from the identity. And the third part of the mental health section and the guidelines also talks more specifically about the psychosocial and biomedical care, which practices that are specific to the individual as well as the family. And that's mostly what the guidelines in specificity have tried to talk about. What's the hope? I think we all are on a journey and we all are in a period of transition. where we are trying to view the history and move towards the future. And we are in the center of it. So I think the mental health section and the guidelines hope that we are able to view the historical and the present together so that we are able to move into the future with all the insights that we have gained till today. And we are able to move really into the future. The other hope that we have is that we are able to reorganize the framework of care. And what do I mean by reorganize the framework of care is we need to include the actual and research determinants. There's enough research across the world to say that the experience of being marginalized itself creates mental health issues. And if that be true, then we need to lay the accountability and therefore the burden of care at the determinant and the changes that are required in them, not necessarily the changes in the individual and the family alone. So reorganizing and stating that the framework needs to be changed is one of the objectives and the hope that we believe we need to bring about. The third hope we have is that some solutions, some specific outlined solutions that can be provided, which are empowering to all concerned social systems and individuals. So while we all often talk about how it is important to be equitable, many people who come to me often ask, how do we do it? We don't know how, because that's not something that, how can I be gender affirmative? And I keep silent because I don't want to offend someone, because I don't know the right language to address the person in. Therefore, I actually keep silent, not knowing that the silence itself may be causing a burden. So I think one of the hopes is to write down within the guidelines simple but specific solutions that can feel like the individual as well as the system feels these are the 6 things I can do to actually be affirmative in my care. So that's one of the hopes. And the last thing that the hope really is about is to foster accountability in social systems. So once we are able to identify that the problem is social and state it, the next part is then the accountability in the social systems about themselves as determinants of mental health. If they are the determinants, then do they understand? And when I'm saying they, I'm also part of they, but do they understand what the impact can be, both in terms of determining the problem, but also in terms of solutions? So if a social system is willing to change, do they understand the enormous impact it can have? And that's the part that the real hope is about. And I'm going to stop here